haven't seemed to make a difference. There's even people now praising Florida's response and talking about the fact that many states that had apparently quite different approaches to non-pharmaceutical interventions and even vaccines now have similar results at the end of the day. So what difference does it make? And I think it helps to kind of go back and look more specifically at what happened during which period of time. So what I did is I took the top 10 states in terms of COVID mortality per million population. Number one, the state that has the dubious distinction of being number one is Mississippi. You can see that Mississippi here has had, Mississippi here has had a relatively steady progressive increase in total deaths over the course of the pandemic. And what I did then is broke down the pandemic into essentially three phases. The first phase being up through August 1st of 2020. At this point, this is essentially roughly accumulating deaths that were the result of cases that were infected up till about July 1st or so, understanding that there's generally a lag of about a month from cases to deaths. And so the idea here is in that early phase up until August 1st, everybody was kind of in the same boat as being slow to react. Some states got hit harder than others. Everybody's response was much more similar. And by August 1st of 2020, really July of 2020, we had different philosophies and strategies for non-pharmaceutical intervention. Some states kind of relaxed and just stayed that way. Some states continued more hardcore non-pharmaceutical interventions. And so this I call the NPI phase, and that's really between August 1st of 2020 and March 1st of 2021, when by that point you have the opportunity for vaccination to kick in and provide protection for the most vulnerable of the population, assuming that, again, those most vulnerable got vaccinated by the beginning of February, and again, allowing for a month lag time. At that point, the majority of people who are susceptible to severe infection and death, certainly before the advent of Delta, you kind of achieve the new phase after March 1st. And so from March 1st onward, that I've described as the non-pharmaceutical intervention plus vaccine phase. So these three different phases, and looking at what the total mortality impact has been across those phases. So again, Mississippi is the highest per capita COVID mortality, 3,435 deaths per million from COVID in that state. And you can see that they did relatively well early on. They had 16% of their fatalities occurred before August 1st of 2020. They had a significant jump in case fatalities that occurred between August and March in the non-pharmaceutical intervention phase. They've had about 65% of their deaths there, and then another 35% of their deaths in the late phase vaccine plus NPI. So they've acquired more than a third of their deaths really since vaccines have been available for the highest risk, and there really should be very minimal deaths at that point. The second highest per capita mortality rate in the US from COVID has been Alabama. Even more pronounced than Mississippi, Alabama had very few deaths in the early phase. They had a significant chunk of their deaths that occurred in the non-pharmaceutical or NPI phase. And then, as you can see here, again, a pretty large chunk of 38% that occurred during the vaccine plus NPI phase. And Alabama's had 3,272 deaths per million. Moving on, New Jersey is the next state. Here, this is relatively representative of a lot of states in the Northeast and the East Coast, where they had a very high accumulation of deaths early on in the pandemic with the first wave. Really up until August 1st, they had over half of their deaths that they actually accumulated during that first early phase. During the NPI phase, you can see they had a relatively small increase in deaths, mainly due to the winter wave. As you can see, they're accumulating deaths in January and February. And then since then, in the vaccine plus NPI phase, have actually had a pretty low accumulation of deaths there. New Jersey's had 3,178 deaths per million. Next is Louisiana. Louisiana, like a lot of other southern states, has accumulated the majority of their deaths since the NPI phase started, but you can also see they got a head start in a lot of other states, and that's because of Mardi Gras. So they had almost a little over a quarter of their deaths occurred before August 1st. And if you remember, Mardi Gras of 2020 was a huge super spreader event, and they had a large number of cases and deaths that occurred early on. And you can see those spikes there on the left there in those graphs. And then they've had kind of a steady increase in growth ever since then. And again, that's true of a lot of the southern states, this steady increase since the non-pharmaceutical phase was entered. Next is Arizona. Arizona had a very low rate of deaths relatively early in the early phase, but had that relatively large summer wave in summer of 2020, and then another large wave in the winter of 2021. And since then has had a more modest rate of growth since the vaccine phase, as their vaccine implementation has gone relatively well. Arizona's had 2,996 deaths per million. Next is New York. So New York, like New Jersey, had a very large proportion of their deaths that occurred in the early phase. Almost 60% of their deaths occurring before August 1st of 2020. In that giant early phase spike. And you can see the death spike there on the left side of the epidemic curves is pretty pronounced. They had another pretty big surge in deaths that occurred in the winter wave that got them up to 91%, but you can see only 9% of their fatalities have occurred since March 1st of 2021, again, when vaccine protection has been readily available to the majority of high-risk people, and they've had just under 3,000 deaths per million. Arkansas is number 7, and you can see, like the other southern states, very low number of deaths early, and they've accumulated most of their deaths in what is a relatively steady increase with some slight bumps associated with epidemic spikes that have occurred since then. But again, 93% of their deaths accumulated after that early phase. Arkansas has had 2,849 deaths per million. Georgia is number 8, and Georgia, again, like Arizona, had that big summer surge. So they didn't accumulate a lot in the early phase, had the summer surge and the winter surge. And now since March 1st have even accumulated 42% of their deaths. Florida is next, again, Florida being a poster child, apparently, for some people who think that they've managed the pandemic incredibly well. And it's true that their totals are less than New Jersey and New York in terms of overall COVID mortality per million. They're at 2,833, but if you look at when they've accumulated that mortality, again, it's been almost all since the NPI phase started in August of 2021. They had a large summer surge of cases with a corresponding surge of deaths, a surge in the winter, and then a giant surge in deaths that's been associated with the Delta wave, when Florida has generally eliminated any and all attempts at non-pharmaceutical interventions and is issuing rules against actual vaccine mandates. Oklahoma is number 10, bringing up the last of the top 10 or bottom 10, as it were. Oklahoma's had 2,802 deaths per million. Again, very few early in the early phase, most occurring during the NPI and the vaccine phase. If we compare now all these states together and look at how many deaths per million they've accumulated since the NPI phase began in the beginning of August, you can see that New York and New Jersey are actually outliers in terms of excellent performance. New York has accumulated fewer than 1,300 deaths per million since that NPI phase began. New Jersey has accumulated about the same, a little over 1,300 deaths per million. Contrast that with Florida, which has accumulated almost 2,400 deaths per million since the beginning of the NPI phase, and 1,300 deaths per million just since vaccines were readily available in March. So, if you look along the far right column there, that shows you how these states have fared since vaccines have been readily available. You can see New York has a dramatically lower fatality rate since then, and states like Mississippi, Alabama, Louisiana, Arkansas, Georgia, and Florida, who have all essentially abandoned non-pharmaceutical interventions and have put in place policies that have actually restricted the wide availability and wide implementation of vaccines, particularly vaccine mandates, that have all done horrifically since the beginning of March. So the bottom line, and what I'm attempting to show, is that policy choices make a huge difference in how states have acted and engaged in that, have made a huge difference. If we're wondering about our own state, we have done relatively well in terms of fatalities overall. In terms of the COVID fatalities per million, we're about 40th in terms of state ranking. But if you look at where we were on August 1st of 2020, we had only accumulated 388 deaths out of the total, essentially almost 3,000 that we have achieved now. So 85% or so of our deaths have occurred since that beginning of the non-pharmaceutical phase. And so our choices have also made a difference, just like these other states. That's all I got. Thanks.
Thanks, Dr. Lawler. Questions this morning? Thank you. Okay, let's share some data. I don't know, I'll just pause for a moment and see if Dr. Antone's on this morning. He sent me his data, but I don't think he's on. Okay, so I'll just quickly go through his couple of data slides. So I believe we're up to 458 cases. As of the 17th, so today's the 19th. So I looked, and the dashboard has the 458. So that was right around that 11.5% mark as a percentage of COVID cases to staffed beds. So the next slide, and we'll send these out, but I believe that the trends have probably not shifted a great deal since he presented on those on Tuesday. So case counts continue to incrementally go up. I don't know if we have any of our peds folks on. I believe we were right around 7 COVID pediatrics on the dashboard when I looked earlier today. So I'm not sure what we're seeing in our peds hospitals as far as anything else. So I don't know if Dr. Simonson or Dr. Sato or anybody's on to speak to anything from a peds perspective.
Sorry, I don't know a number right now.
Okay.
No. So this is Chris Maloney. We have 4 as of this morning in-house.
Thank you. And we were able to, the state